The Majority Leader.
The opioid crisis is hurting communities across our country. Its challenges are complex, and its causes are many. As I said last week, no single bill or program is going to solve this crisis on its own. Only a sustained, committed effort can do that. That's been my view over the years that I've been involved in this issue. From the first time I invited the White House drug czar down to eastern Kentucky to see the challenges posed by prescription drug abuse firsthand, to my work on other initiatives like passing a law to help address the tragedy of babies born addicted to drugs. It's also what I believed as the Republican-led Senate worked hard to pass important legislation like Jesse's Law, the 21st Century Cures Act, and the Comprehensive Addiction and Recovery Act in the last Congress. I believe President Trump took the same view as he announced another important step last week by declaring a public health emergency for opioids. I would like to once again thank the President for his commitment to continuing to confronting this crisis. We all know there's much further to go, and as we're moving forward, Republicans and Democrats, the House and the Senate, states and the White House, we should remain committed to working together on policies and programs that actually deliver results. About an hour ago, the Government Accountability Office released a report I requested about the federal government's response to opioid use disorders. The government's chief watchdog recommends that as the Department of Health and Human Services expands access to medication-assisted treatment, it should also develop clear measures to gauge performance. The GAO study will help to ensure that dollars are spent wisely to fight the crisis of opioid abuse taking lives in communities all across our country. The announcement of GAO's conclusions will help us as we continue to build a comprehensive approach to combating heroin and prescription drug abuse. This is another step in the right direction as government officials review this morning's report and as agencies develop new plans to fulfill its objectives. I'll continue to work with partners in Washington and Kentucky to address this important crisis. The goal, of course, is that one day we can finally put the pain of opioid abuse behind us once and for all.